Heart failure occurs when the heart cannot pump enough blood to meet body's metabolic demand. Heart failure could be divided into various types based on the disease progression, the type of dysfunction, and the location of the heart failure. Based on the disease progression, heart failure could be divided into acute heart failure or chronic heart failure. Acute heart failure is rapid in onset, and it is often caused by an acute myocardial infarction or a massive pulmonary embolism. Chronic heart failure is slowly developing, and it is caused by coronary artery disease or chronic hypertension. Heart failure could also be divided into two types based on the type of dysfunction: a systolic heart failure or a diastolic heart failure. Systolic heart failure is a problem with the contraction of ventricles, meaning the ventricles are not contracting enough to pump sufficient amount of blood. Whereas diastolic heart failure, there is a problem with ventricular filling, meaning the ventricles are not filling with enough blood to be pumped. Ejection fraction is something that can be used to help in determining the type of the heart failure. So what is ejection fraction? At the end of the diastole, ventricles are filled with blood to be ejected during systole. This volume of the blood is called an diastolic volume. During systole, however, only a fraction of this blood gets ejected, not all of it, and that fraction is called ejection fraction. So ejection fraction can be calculated by dividing stroke volume with an diastolic volume. So in systolic heart failure, ejection fraction is usually below 40%, whereas in diastolic heart failure is usually normal or not affected. That's how one can determine which type of heart failure it is. Based on the location of the heart failure, it could also be divided into right-sided heart failure or left-sided heart failure. Left-sided heart failure is usually caused by systolic dysfunction. That is when the heart cannot pump enough blood. The left-sided heart failure is often caused by conditions that can cause myocardial damage, such as atherosclerosis, which can result in myocardial ischemia or infarction, both of which can damage myocardial cells, and it affects the contractility and the pumping ability of the heart. Another condition that can cause myocardial damage is hypertension. In hypertension, there's increased pressure in the aorta, so left ventricle has to push harder against this increased pressure. In turn, the heart muscles cells grow bigger, they hypertrophy. And due to hypertrophy, the myocardial cell wall, the ventricle wall, thickens, resulting in the reduced size of the ventricle. This results in the decreased preload, meaning there's less end-diastolic volume to be ejected. Thickening of the ventricles also weakens the heart wall, and it affects the contraction. Other conditions that can cause left-sided heart failure are valvular disorders or cardiomyopathy. Clinical manifestation of the left-sided heart failure are those of pulmonary congestion. When the heart cannot pump enough blood out, it accumulates in the left ventricle, which then backs up into the lung, causing congestion. This is called congestive heart failure. The increased fluid in the lung then enters in the alveoli and the interstitial spaces. This results in pulmonary edema. The symptoms of the left-sided heart failure are then dyspnea or orthopnea due to difficulty in gas exchange, frothy sputum, and crackles can be audible upon auscultation. Right-sided heart failure is often a result of left-sided heart failure. Pulmonary congestion caused by the left-sided heart failure result in increased pressure inside the lungs. Right ventricle now has to push harder for the blood to get ejected into the lungs. This weakens the right ventricle and it cannot empty fully, causing congestion in the venous system. Isolated right-sided heart failure can also occur due to conditions such as left to right cardiac shunt or in a patient who has chronic pulmonary disease. The signs and symptoms of the right-sided heart failure are those of the systemic congestion. When the right ventricle fails, blood back up in the vena cava and then into the system. The fluid accumulates in the various parts of the body. The manifestations include jugular vein distension, meaning jugular vein gets enlarged due to all the fluid in the venous system. Liver and spleen gets enlarged. Ascites, fluid in the peritoneal cavity, and pitting edema of the lower extremities. The pharmacological management of the heart failure depends on the type of dysfunction and the severity of the symptoms. However, the most used medications in the treatment of heart failure include diuretics, ACE inhibitors, and other medications such as beta blockers and digitalis. Diuretics are most frequently used in heart failure because they reduces congestion and fluid overload. ACE inhibitors, they dilate the blood vessels and reduces afterload. They also reduce sodium and water retention and thus reduces the preload. The nursing management of the patient with heart failure include keeping record of intake and output to identify a negative balance, meaning there should be more output than intake. Daily weighing of the patient at the same time, usually in the morning after urination. Here we are looking for 2 to 3 pounds gain in a day or 5 pounds gain in a week. Auscultating the lung sounds every day to detect an increase or decrease in the crackles. Identifying and evaluating the severity of the pitting edema. Limiting the sodium intake for less than 2000 mg per day for heart failure patient. And last but not least, it is important to be active but have rest periods between activities to reduce workload of the heart. To learn more about other topics in nursing, please check out my channel and subscribe.